Well, what hospital are you at right now?
It's the Cortellucci Vaughan Hospital. This one looks like really cool. It's got like automation and robotics. This morning, a self-driving floor cleaner was going around, and yeah, it's nice. Yeah,
In a couple of years, it might be a self-driving nurse, but we'll see if we get there.
yeah. If there's, so they are the first people in Canada to do what I kind of sell. So they're like pretty innovative. It's a new hospital, but they recruited a lot of people from like some of the more notable hospitals in the area to kind of like say like this is basically a new hospital and it's built for purpose for going like the digital
Yeah.
route and like technology forward. So it's cool. Yeah, I like it here.
Do you know on average how many pathologists are in a hospital?
Yeah,
Just out of
yeah,
curiosity.
it really depends. This one has 14. This is like a community hospital, but someone like UHN has 40, but they're the biggest in Canada. So I would say it ranges from maybe 5 to 40 pathologists, but that might change with the whole advent of what we're trying to implement at Leica. Now that they can sign out cases from their house, you don't need to be in a specific geographic location. We work with Newfoundland, who have zero pathologists actually in the province. They have pathologists based across Canada that remotely sign out all, yeah.
What?
They were the first ones to implement it out of need, really, because they couldn't recruit pathologists to live on the island. So they had to, implement it, and they were one of the first ones to do so.
Wow.
Yeah.
I guess that makes sense, especially for, more remote
Yeah.
areas,
Yeah.
hospitals.
Yeah. Yeah.
Yeah, because everything is just digitized right now.
Yeah,
Yeah.
I mean, like before that, what they would do is like put the, glass microscopic slide in a shipping container and ship it. I know there's some places in northern Canada that actually like put it on snowmobiles and drive it to the next hospital. But
Wow.
now they can just scan it and then like as long as you have the credentials to remotely, log into the network and look at the case on your computer, that's the future of pathology, I think. And then like what's still 5 maybe 10 years away is using algorithms to help see the slides, maybe do some quantification of certain biomarkers in clinical settings. But it's all like kind of, the first step is digitizing the slide, and then yeah, it's coming up. With regulatory, it always takes time. I think people are still most comfortable when there's a person behind the diagnosis, but there's like, frameworks coming out now, and people are self-validating some of the algorithms to not do a diagnosis, but like, you know, make sure that a pathologist is not missing something. But I've seen like in the research setting, some really cool algorithms that are like quote unquote faster and more accurate than pathologists at finding certain things. Because, you know, what I've learned is pathology is just becoming more and more complex. Even like 50 years ago, there was a handful of subspecialties, and now there's over like 50 subspecialties. Every cancer has a new biomarker that you kind of have to look out for, and computers and algorithms are very good at pattern recognition. So if you train it correctly, it'll be pretty good.
Absolutely. I mean, you were saying there's 40 pathologists at UHN. I mean, in the future with the onslaught of I can totally see AI being
Yeah.
much better at a human,
Yeah.
much faster and better, right?
Yeah.
And so in the future, I hate to say this, but they may not need 40 pathologists, They may need just a handful.
Yeah. And I think like pathologists are starting to realize like it is a tool. The saying always is like, AI won't replace you, but someone using AI probably will.
Yeah, I've heard that many
Yeah,
times.
it's across like every industry, really. I mean, I putting together a PowerPoint presentation, I couldn't find an image that I liked on, Google search, so I used ChatGPT to generate something for me. And it's not
Yeah.
perfect, but like, if you need something in a pinch, it's a pretty good tool. In my short time in this world, have seen a change in tone from pathologists from being very hesitant to implement digital pathology for that reason, for algorithms, but now seeing that, oh, it's going to help me to quantitate something so I don't have to spend, 60 minutes counting PDL1 biomarkers anymore. I can just run an algorithm and it'll do it very accurately in seconds. Those things I think will come and be Health Canada approved first before you can just kind of click the easy button and it shoots out a diagnosis.
You make a good point, actually. You think all these tools have to be Health Canada approved for,
They've got a
all these specialists to use them officially, right?
In Canada, yeah. I mean, it's a
Yeah.
different story, across the border in the US. They will self-validate more. They'll run a study internally on 40, 50, 60 cases, and then they're comfortable and their medical director will sign off on it. But in Canada, we're run by RFPs for this type of equipment. And the first question is always, is it Health Canada approved? Which it is a seal of approval. It does give that company a little bit of confidence that some regulatory body has at least given it the seal of approval. I have yet to see any medical device in this field be used in a clinical setting that doesn't have Health Canada approval. It's just, for better or for worse, it's just a requirement. And I don't know if that'll change. Health Canada, from what I see at least, is a little bit easier of an application and approval process than the FDA is.
Yeah, we'll see. I know the current government is keen on wanting to eliminate all the
Yeah,
regulatory barriers, especially when it comes to construction and housing. And who knows if that's going to translate to this stuff, right? The science and the healthcare field. We'll see. But yeah, the healthcare field is always a little bit more sensitive and of course, than putting cement down.
yeah, of course. Yeah,
I'm always fascinated on how people end up where they ended up, especially in our
yeah.
industry. Took a look at your LinkedIn profile, and your path seems to be a little bit more straightforward than others similar to mine. You studied science at U of
Yeah.
T. One thing I want to ask you is, was it a minor or another degree in psychology?
Yeah, so I double majored in biology and psychology. And when I
Okay.
was my undergrad, they also had different streams of biology. So I did like the neuroscience stream. I was really fascinated with that aspect of not just like the social psychology aspect, but the biology of the brain. So yeah, I was able to do both. And UFT had a really cool program. It was called a Research Opportunity Program that honestly, I just applied to on a whim. But what it was that I was paired with a professor who ended up being the neurobiology chair of Canada. And in my undergrad, did a research project with her where, typically your undergrad, you're just going to lectures, you're going to some practicals and lab sessions. But one of my courses was working one-on-one with a professor doing a project. And that project ended up being published in a journal. So it was unbelievable to gather that experience, just like, the off chance of just applying to something. And it gave me a pretty good grade too. So I boosted my GPA, which was nice because when you work one on one with a professor, they help you out with a pretty good grade. I mean, I put in the work, but it was great. You got really one on one learning experience with a really like notable professor. Like to this day, people reach out to me and say like, "Oh my gosh, couldn't believe you got to work with Dr. Alison Fleming," because she's very well known, one of the most published scientists in Canada. And like at the time, you're undergrad, you don't really know this stuff. But then when you start to work with her and find out all the publications that she's done, and really, really notable scientist.
Wow, so you got a paper with your name on it with Dr. Fleming on
Yeah,
it?
yeah.
I mean, that's a pretty cool way to graduate, right?
Yeah, and I think I got like the notification because papers, take a little while to get reviewed and actually, get the notification that it's going to be in a journal. I got the notification that it was going to be published like a day before my first interview at like, your first post university job. That was
Yeah.
like something that I could speak to right away in that interview, which I'm pretty sure helped me get my first job. So it's just, a series of events of luck and putting in a little bit of hard work and then just good timing, really.
Timing.
Yeah.
Timing's
Yeah.
everything. It looks like you knew early on you wanted to get into science and spend the rest of your career in sciences. Is that why? I mean, you wouldn't have applied for that program in undergrad, but was that a very clear path to you even before undergrad in high school?
Yeah. I was always fascinated by the sciences. Specifically, biology was something that I really enjoyed in high school. Also, I should say my whole family, I have two older sisters, they both have biology degrees from UofT as well. One of them went on to be a high school biology teacher. So you could say biology was something that all of us kind of had an affinity towards.
Was it parents influenced?
Yeah, you could say that, immigrant parents, be a doctor kind of thing. And then the first step is to
Uh-huh,
go
uh-huh.
to and do a biology degree.
Familiar with that, yeah.
But yeah, my dad was a banker. My mom worked at a hospital, but just in an office manager role. So
Hmm.
I think in general, they always wanted us to go to a good school. And yeah, I just kind of, loved it. I thought it was really interesting that you could be part of something that has been around for so long and is still evolving. And, in my current day work, I'm now part of this company that has pretty revolutionary technology that, I can speak to medical professionals, not so much PhDs, but more so MDs, about a technology that can influence patient care. So, yeah, science, I think yeah, I would say from high school. It was something that I always liked and had some good professors at UofT and got some good mentors at some of the first companies that I worked at. Yeah, I think that's where my career path will continue to be
Did you ever write the MCATs?
in. No, I didn't. I wanted to work pretty much right out of school. My mom was an office manager for an ophthalmologist in Toronto. And so I actually wanted to get into pharmaceutical sales. And I had a really good many lunches and dinners with pharmaceutical reps to learn about that industry.
Oh, wow.
So I didn't end up going to pharmaceuticals because they said it's like really competitive and it's actually a changing industry where there's not too many reps now and it's much more regulated. So I leaned more so on the research side of things initially in my career. Now I'm in the clinical sales, but more so in medical devices. But yeah, I didn't write my MCAT. I have flirted with the idea of writing my GMAT for the MBA course. So I think I have the science background going to school at UofT, but everything that I've learned about sales and in my role, I am a national sales specialist. I think I could learn more about sales from doing that. So I've taken courses on writing my GMAT for the MBA entrance exam. I've gone to enough MBA schools where typically they take you on a tour and they give you like a sample class kind of thing. And it always intrigued me. I thought like everything is just being able to think of a problem in different ways. And I think that will teach me some skills. So it's in the plan. I was going to pursue it more, but earlier this year I bought a house in Toronto.
Oh,
So yeah,
congrats.
thanks. So a lot of the money that I was going to put towards the MBA
Yeah,
school kind of went through the deposit and down payment.
gotcha.
So it's on the back
Gotcha,
burner for
yeah.
now, but yeah, always something I can explore.
So you're like us, and paying your mortgage for the rest of your life. Okay.
Yeah, yeah, yeah.
So I guess you're like me. You followed along with your parents' dream, but only halfway.
Yeah,
You
they
didn't go all the way through.
I think at the end of the day, they're just like, get a career that you can, pay the bills. And what was the most mandatory was, go to a good school and graduate with a good GPA. I
Yeah.
think, uh, I think business school is probably,
Check, check.
yeah, business school is probably in
Yeah.
the future. Again, as you probably know, it's MBA is important but not mandatory. I think it'll teach you some skills, but it's not everything. And yeah, just something that,
Yeah, you've got life skills. I
yeah,
mean, when you were interning with that PI,
yeah.
you learned more there than what any book or class could teach you, right?
Oh
So,
yeah.
and you're doing that now, what you're going through, your career changes. That's huge. So experience counts a lot for sure. Yeah, and it also depends on the industry. Like I think if you're maybe in a finance
Yeah.
industry, the MBA has much more weight
Yeah.
and you probably a lot of people get that earlier
Yeah.
on. But, I was surprised initially to realize in our industry in the life sciences, there's a lot of people in high
Yeah.
level roles that do not have an MBA.
Yeah.
And so made me realize that, my personal choice was I think we all go through that decision where,
Yeah.
okay, you got your bachelor's, you've been working for a couple of years, what's next type thing. The MBA is a lot of times the first on a list to try something new. But yeah, once I found out like all these CEOs or VPs what? Like they don't need one? They don't have one? Okay, well, it makes you think, it gives you the confidence to say, okay, well, I can just ride this wave until
Totally agree.
until I hit a
Yeah.
wall.
One of the reasons why I wanted to pursue it was to get a promotion, and I ended up getting the promotion without it. So,
There you go.
it's a catch-22. If you have that drive to learn and listen to podcasts or watch YouTube videos or go to the library and grab a book, that's the most important. I remember when I was, you know, so I took a course, it's like a 6-week course just writing the GMAT strategies and relearning because a lot of this stuff was, the GMAT has a verbal section and a quant math section. Verbal section I can get through, no worries. It's challenging, but who remembers calculus from high school?
Not
Yeah,
me.
that's what I wanted to
Not me.
relearn.
I
But
can tell you that.
um, what I learned is it's just like, putting in work. And I think even without that degree, although it, maybe separates a resume from another one, if you actually talk to the person and learn that, they're a learner, they will go back if they don't understand a concept. And even if it's not within their knowledge at the time, there's enough resources out there to pick it up, right?
Problem solving skills. I think that's the key right
Yeah,
there. You're right.
yeah,
And being
yeah.
resourceful. You've been in sales. Is that correct if I say that? You've been in sales for most of your career?
Yeah, I would say 10 of the last 12 years in sales and in different capacities. As with most people, like I kind of sharpened my sword in inside sales first, and then moved more into like a sales account executive kind of role and sales territory manager type of role. And I've been lucky enough to look after a diverse set of end users. So, first in research in Canada, and then looking after more so like translational work. And then now eventually I moved over to the clinical side of things. It's always interesting to see how different products kind of work in different workflows, but at the end of the day, it's really all about trying to understand what your end user is trying to accomplish and try to position yourself. Like what I've learned early on is you can have the best product in the world, but if you're not solving the specific solution or even just presenting it in a certain way to somebody, that's what's going to win or lose deals for you. But yeah, sales I find is, the engine of every single company. You could have pretty much every department running really well, but if your sales team is not performing, I find that interesting. And I find a little bit of, I've been at least told that there's so many different sales techniques and styles, and I try to be a little bit different and learning different techniques every single time and constantly learning. You've lived the life of, the highs and lows of it, but I think the highs greatly outweigh the lows, and it's really cool. Like right now, I sell into the clinical market. You see these tools being used to help diagnose or treat patients. It's pretty rewarding.
It is very rewarding. Yeah, you have a direct effect of someone's life. And that's part of the reason why I love this industry is you playing a small part in helping humans,
Yeah.
your fellow colleagues, and better humanity, which is great.
I love
Ah,
one point that I'll say on that is like sometimes when we go to conferences, typically you'll have, patient advocates that are up on stage with, the doctor that uses a certain technology to find something that hasn't been done before. I think that's like the coolest. And what more conferences should have, like actually patient advocates that share their stories because it's powerful to see someone that was, you know, maybe not would have been in the healthcare system would have been treated a different way even 10 or 15 years ago. The technology didn't exist. But to see them stand up there, that's really, really cool. That's what I enjoy.
yeah, it gives you a sense of purpose, and that's what's important, I think.
Yeah.
Sometimes on, like you mentioned, really challenging
Yeah.
years, you need to find that what gets you out of bed,
Yeah.
right? And that sense of purpose, and to remind yourself, yeah, me and my company and my colleagues are making a difference. So that's important. That's what's helped me through the tough times for sure. Now in sales, I mean, and you mentioned sales, like, I think the ability to connect with that person, you mentioned, presenting the solution in a manner that connects with the person in front of you, that is not as obvious as, you think. And that takes a lot of years to learn that skill and to understand that skill. And that's personally what I love about sales is that, every approach is different. Every human is different. You can't apply the same, like you said, sales technique, follow it by the book. That just doesn't happen,
Yeah.
right? It's every situation is really
Yeah.
unique. And that takes, like we talked about, that takes time, that takes experience. There's no book or MBA program that could teach you that. That's coming from you, just learning. The advantage that you have is that you've touched a broad customer base with different types of solution. So you have a broad kind of lingo and sensitivity to their needs, which is great. After this phase, you might jump into a completely different industry
Yeah.
and it's all transferable skills.
Yeah. Yeah. You're so right. I mean, I think like there's definitely like books and techniques and ways of doing things. So many techniques that are out there. One, finding like what's the one that works for you. And then two, also like being open to changing it. In my role, I do get to collaborate with other sales professionals, and it's always like, man, they'll say an idea. I'm like, I never even thought of that approach. That makes total sense. And sometimes we do disagree on things, but also it's like, let's figure this out and let's find out what's the best way of approaching this particular opportunity or deal. I find that very cool. You mentioned it earlier on. We both come from like science backgrounds and learn sales kind of in the field. But there's also some salespeople that come to the company that have zero background in science, but they're still
Mm-hmm.
great. They,
Mm-hmm.
just the questions that they ask are very insightful. And if it leads to a customer telling you information that typically you wouldn't have gotten from some of the more template questions that are typically in your sales training or when you're onboarded at a company, it can totally change a deal. But yeah, I think sales is very difficult, but also very rewarding and constantly changing. What I'm discovering now is I fully admit I leaned on the remote aspect of selling too much, but now I'm getting more into the field. I'll spend a couple days at an account if I think it's worth it. And the amount of information that you gather is invaluable. I just trying to piece it all together and then doing one final presentation saying, hey, this is what I've learned. And I'm not saying this is a better way of doing it, but this is a different way and consider it. Maybe this is something that you haven't thought of before or something that you have, and we can look at it a different way. But it's all about providing options, and that's what I like.
The big thing that we're missing when we have these virtual calls is the body
Yeah.
language. We're only seeing from the chest up,
Yeah.
but a lot of it happens below that.
Yeah.
What are they doing with their hands?
Yeah.
How are they sitting?
Yeah. Oh, absolutely. I
And
sit
it's
right after we were doing even in-person conversations, I'm sorry, in-person presentations. I would be up there presenting or my colleague would be. And if my colleague was presenting, I could see, the side conversations between two, people happening. And I'm like, oh, like that usually happens when there's something interesting that, was being presented. And you can maybe next time or later in that day, like, oh, like, do you want to explore that more? That stuff you wouldn't be able to really gather on a call
no.
where everybody has their camera off and you don't even know if they're
Yes.
still there or awake. But yeah, in person, is definitely coming back, and it's definitely something that I think people appreciate, especially now with, I think there's so many tools to automate outreach and stuff like that, but it's, you probably get them the same as much as me. Like you can you can detect a mile away. Everybody kind of has the same outreach type of email.
Mm-hmm.
I mean, and even, to pick up the phone and give someone a call when you don't think you're fully understanding their question. Even if you don't think you can help them, just try. That goes a long way for sure.
We're finding that too with our team.
Yeah.
You mentioned difficulties outside of understanding over the years how to communicate with different type of people. What are the other challenges in sales do you find?
Good question. I find more than anything, our our prospects or customers are more informed. I think they have the tools to go online and do their own research, and whether that research is accurate is questionable sometimes. But I find like it is
It depends what you're selling.
depends.
Yeah, I mean, if you're selling a basic hot plate or, whatever, they pretty much know everything about
It's
it. But if you're selling a high-end microscope,
yeah,
yeah,
yeah.
it's different.
It and it's like where their sources and stuff like that. And for what I do, you're right. What I sell now is a pretty complex sale. Some people come in with a lot of knowledge, some people come in with very little. But before I used to, when I got a lead or I think someone's interested, I used to, hand them the brochure and say, hey, this is kind of what it's like. Let's set up a call. But now I don't even send a brochure at first. I say, like, let's talk first and see, like, actually, maybe you're interested in what you think is the solution, but actually something else is going to work way better for you. And there's no point in confusing you with, you reading on your own. Why don't we just talk for even within a minute? I can tell if my solution is maybe going to work or maybe not, or maybe there's something better. Yeah, I had some pretty good sales managers that kind of, did teach me pick up a call and that discovery is the best in person or on a call because discovery on an email, even though you think you're conveying a lot of information, I've been in the same shoes before. When I get an email and it has two brochures and a lot of typing. Like I, glance at it,
No, you're not reading
absorbing
it.
it,
No.
and I don't know. There's something to like someone explaining something to you, and that works a lot better. And especially for complex
Yeah. So
sales,
what?
you can. There's so much you can talk about. So trying to getting on a call and identifying like the three things that are the most important sometimes is all you really need to do. But like kind of setting all the information to them, you're not really being resourced to them. You're kind of just you know pushing a brochure.
Well, you hit our nail because you might be sending them the wrong information
Yeah,
before
yeah,
that conversation, right?
yeah. A
Yeah.
lot of times
Yeah.
people like, they'll go to a website and they'll, send in, what they think is the right solution. And sometimes websites don't have all the information, or sometimes websites are misleading. I think they're a lot of times geared towards really providing enough information so that you are reaching out to your salesperson. You want to be that resource for somebody. It's very interesting to see, like, again, what we were discussing earlier. Everybody is different, but you're expected to sell everybody on this one brochure. Doesn't make sense, right?
How's the funding situation like these last couple of years with
Yeah, great.
Canadian hospitals right now?
It's all,
Has it gone better, worse,
it's
same?
it's all over the board. I find hospitals are it really depends. And it depends on, and it's part of my job to help them realize that there's different ways to fund this, whether you're using capital funds or operational funds, whether you're applying for a grant or you're able to find foundation funds through a charity like Terry Fox Foundation, or sometimes like Sick Kids Foundation. You get those lottery tickets that you buy and you can kind of win a I don't know, a mansion or something like that. But that funding actually does go towards funding capital projects, right?
Hmm.
So it's in
Yeah.
that. And what I also try to do is, a lot of times it comes down to making a Dragon's Den pitch to leadership or to a funding committee to say, hey, I think this is a really good idea. I think we should implement this, but we do need some funds. It's my job to help them to create that pitch, to say, like, this is something that is new and maybe doesn't have the best return on investment initially, but you'll get notoriety and maybe be the first in Canada to do something. And perhaps in the future, we'll find out some ways to kind of generate some revenue from it. But yeah, the funding situation I find is tough, but there's always different ways of approaching it.
Yeah, you mentioned that your sales cycle is typically 2 to 4 years, and I think a big reason why is because they got to go and get the
Yeah,
funds
yeah,
before,
yeah,
so they can buy your instrument,
yeah,
right? It's such a different beast here compared to the U.S. I
yeah.
think your colleagues in the U.S. are probably experiencing a very different sales cycle in certain areas.
Yeah, definitely.
I
And just
Yeah.
even like I mentioned, foundation funding is way different, right? I mean, you'll get comparing us to the US, you'll get hospitals that do have people that have set up funds or just really call a spade, a billionaire that is, wants their name on a
Donated.
building, and
Gotcha.
it happens much more in the US than it does here. I think there are means of doing that to some regard, but not as much as, Mark Zuckerberg having the Chan Zuckerberg grant that funds, hundreds of millions of dollars per year. It's different. And then also in the US, it's not universal healthcare, so it's not, taxpayer funded. It's, you charge the patient. So they have a different return on investment over there. But yeah, I think like new technologies are harder to get off the ground here. But once they are accepted, and once there is a way of implementing it and having it's not return on investment, but a way of sustaining that technology, I think there's the potential to have it implemented at the provincial level and, it becoming perhaps a standard of care. And then it becomes kind of the norm.
One thing I read with the Carney budget is that he is dedicating lots of money to attract, I think, not only scientists, but just, people leading in their
Yeah.
fields to come and work in Canada.
Yeah.
And so hopefully that bleeds into our industry
Yeah.
and, encourages more funding, more research, more groundbreaking research being done up here. So it's pretty exciting.
Yeah. I think there's always potential. And I think if we can attract individuals to come up north, it would only be great things. So hopefully we see the
Yeah, hopefully more people are okay with paying half their
That's the
paycheck going to
thing.
taxes.
Yeah. Yeah, it's the same thing with sports as well. I mean, it's tough to attract talent for that reason. But, the standard of life is very good here in Canada. And I think, if anything, throughout the last year or so, people are noticing that Canada is a great um, option, maybe alternative to going to the States. And we'll see. I mean, I think we have the infrastructure. We just need
We need the
the
cash.
cash and like more people taking the chance. But yeah, I think it'll be good things for us.
My goal is for a freshly science graduate to realize, there's more than being a doctor out there in our industry and
Yeah,
that you could, have a rewarding career outside of being a doctor. And obviously you're proving it. And
yeah,
good luck to you. Whenever you decide to do that MBA, all the best. Cool. Well, hey, thanks so much for your time, David. I really appreciate it.
yeah.
And we'll catch up again
Thanks for
soon.
the opportunity, Pat. Take care.